Hi guys, welcome back to my channel. So I know I'm making a video after many months, many months, and majority of you have been waiting for my videos. Sorry to keep you waiting. Actually time नहीं लग रहा था यार, and I wanted to क्या कहते हैं haphazardly करना. Hey, this is a podcast session. I'm not a fan of podcast, frankly. मैं बहुत कम देखता हूँ. But this is a special podcast because many people, many of my juniors, YSMU juniors, they ask how to clear the final exam. So this podcast is dedicated for them. 30 minutes का podcast है in which I have summarized along with Dr. Srishti, who has just graduated from YSMU this year. So what all were the tips and tricks she used to crack the final exam? What all were the sources of study for the final exam? Because मेरे को graduate हुए हो गए हैं 4 साल. I have graduated in 2018. So many things have changed. COVID आया and everything, and now again back to the old rules but with a twist. So this podcast is very important for the final year people and the pre-final year people of YSMU. So I hope you are going to enjoy this. इसमें मैंने ज़्यादा कुछ ऐसा वैसा कुछ नहीं डाला. Just kept it simple and smooth, so that क्या कहते हैं, you can just enjoy the original conversation that we had. And I hope you will like this podcast and do subscribe to my channel. अगर subscribe नहीं किया है अभी तक, don't forget to like, comment. अगर आप लोगों का कुछ सच में मन कर रहा है like and comment करने का, because it helps me, it motivates me to create more such videos. And now enjoy the podcast. I'm good. How about you?
सर बस कुछ नहीं ऐसे
So,
रिलैक्स
how are you feeling? पहले तो ये बताओ.
वेरी एक्साइटेड एंड हैप्पी बहुत चिल लग रहा है.
First of all, my congratulations to you.
थैंक यू सर. It couldn't have been possible without you and my parents, and wow, all thanks to you. अगर आपकी गाइडेंस नहीं होती तो नहीं होता.
Thank you so much. Thank you so much for it. So it was basically all your hard work, यार. Frankly, उसके बिना तो कुछ भी possible नहीं है. So how was your journey of final exams?
थोड़ा बहुत एक्साइटमेंट था, and then there was like nervousness, lot of nervousness, some positive vibes, some negative vibes. कई बार ऐसा लग रहा कि बस अब give up कर देना चाहिए, but then it was like no, I had to keep going. Like after coming so far, I cannot stop.
That's true. Like usually a give up wala phase comes up when it is almost like 70-80% of the things have been done, and then now you're totally exhausted. But last 20-30% के लिए you need that energy.
हाँ.
So that's great that you were able to conquer it. And उसके बाद क्या कहते हैं? So what was the overall percentage of students? How many have passed?
Around 80 to 85% of students have passed.
Okay, so मतलब 15% तो हैं at least who were not able.
Yes.
Mainly they flunked in Viva or somewhere else.
So MCQ exam was much more difficult than Viva, because in Viva you can speak something or the other.
Yeah,
but
that's correct.
In multiple choice, it makes you confused. And overall, if you will see, like computer exam has a timing on top of it, and it will tell you right away that your question was right or wrong. So that makes us more nervous.
I can totally understand that. That was like गले पे तलवार लटकी हुई है.
The most terrible situation my friend has suffered was like he had 5 questions to attempt. Only 5 questions he had to make right to pass the exam. Each and every question he should make right so that he will pass. It was terrible.
In which subject you faced such thing?
It was obs and gynae. It was the last exam, and we were like, we were so exhausted about after giving the surgery viva. First we had internal, then we had surgery, and then we had obs and gynae.
Okay.
So after surgery, we were all so exhausted that we have started giving up. Like, let's just be done with the exam and let's just be over about it. We just wanted to pass the exam, and we didn't want to score good marks.
It happens with all of us. Like the last exam always gets neglected.
Yes.
So how was the pattern of the exam?
Uh, So pattern, if I talk about surgery, they had 10 questions from general surgery. Then they had a few questions from each topic. So you cannot leave any topic and go. And for
Yeah.
about option 9A, from everywhere they have asked something or the other. And same goes with the internal. Because in internal, they say that some questions are from cardiology, like 20 to 20 questions were from cardiology,
Yeah,
then
yeah.
10 questions from something else. But this year it was not like that. Randomly they have put the questions.
Okay. तो मतलब कुछ फिक्स्ड वेटेज टाइप का नहीं था for the medicine.
नहीं, नहीं.
That's tricky because
Yeah.
earlier it was like, yeah, you can expect something.
Because that's what our seniors have told, like study from this part so that you will be able to pass the exam.
Yes.
But this year it was so crumbled up that we didn't know what to do.
So basically, this year they just tried to give it a fresh shot at the fresh pattern.
Yeah.
And did you had some kind of break in between exams? Like, for example, between the practical MCQ and the viva of the same subject?
So first we had the practical. In the very next day we had the MCQ exam. After
Okay.
that, 2 or 3 days will be given off to prepare viva, and then there's viva. Then again 2 to 3 days we get up off. Then we will have practical of another subject, and then goes for the MCQ and viva the same day.
Mhm. So this thing that means that like in the previous 2 years due to COVID they didn't conduct the exams in the proper
Yeah.
manner, but this year they conducted it, but थोड़ा सा twist के साथ.
हाँ.
Because earlier you used to get like easily 1 week off between the two vivas.
Yeah.
And which one you found as the easiest and which one you found the toughest?
I'll say there was nothing, no such thing like easiest and the difficult one. Because for the internal, it was the first exam. And we were like, internal is easy, you can apply general knowledge and you can
Yes.
do. But when it comes to the first exam, you don't know how it's going to be. How the
Absolutely.
teacher's going to take your exam and everything like that.
Absolutely.
But after the practical was done, we were like, okay, it was easy. Then the MCQ, oh, we should have prepared a little bit more. Then Viva. Viva was like, we used for the Viva, we only used videos because we had already studied for MCQ, so now we had the knowledge. We just have to
Absolutely.
revise it.
Absolutely.
Yes. So for that we used Osmosis and Ninja Nerd and some other videos like Lecturio and other things. And then we were done with it. Like Armendo was a good source. So we used all this video to revise it, and we took our short notes which we had created, like these things we need to remember. So we revised and we went. And the Viva was like very easy. We found out that teachers were very helpful, and they just wanted to know that we have the knowledge. They are not sitting there to fail you. They were just helping us if we forget a point, and they are prompting us like say something like that. And we were like, yes, you are right. We have to say like this.
Yeah,
So
absolutely.
it was like that.
Because they are always pushing you even in the viva. It's not like they don't want you to pass or something. If you will not utter something,
Yes.
that's the only situation when you will get stuck.
Yes. For Viva, the few students who have failed, I have noticed like they haven't said much or anything about it, or they are saying totally wrong. That's why they fail. Otherwise, MCQ exam is like a bit more confusing. We all know that. So that's why
Absolutely.
most of the people fail in that. And it's also about the luck. Honestly, the exam is always on your luck basis.
That's true. Luck plays a part. Beat any exam. Or
Yeah,
in MCQ, the thing is, no one can help you out. You're all alone on your own.
exactly.
So, how was your preparation strategy for each subject? Like, let's begin with surgery.
Okay. So for surgery, we know that we cannot use any other source than our university books. So what we did, we had collected the notes of our previous year's seniors, and we know that they're gonna have such questions. So we took their questionnaire and started preparing according to that. So we started making notes from the beginning of September of first semester, 6th year. So we started making the notes, and we were studying and reading and writing the notes. We were done with it within first 3 months because we are also preparing for internal and obs gynae uh, notes, etc. And we were like, okay, let's be done with it.
Yeah.
So by the end of first semester, January, we had the notes prepared for surgery, and we had read all of these topics at least once.
Mm-hmm.
Then we thought we will prepare for the Viva and MCQ within next 3 months, and after that we'll have revision. But the point was we weren't able to do any of that thing. Till the last day, we were like, oh no, we have left with so much topic, and some of the topics are so ridiculously boring that we weren't able to study it. For example, that proctology. That topic was like going above the head. So it was like that. But as far as I remember, we had completed the surgery. The first revision was done by the end of May at least, because the last cycle we had was surgery only. So it helped us a lot for revising all of these things. Few topics were like written wrongly in book, and the teachers has accepted it. That it's not right, but you have to say it like this one. So we asked our teachers, like for example, Dr. Minasyan from Rajyan, he said, you have to say it like this only, or use my presentations which I have prepared. So we used those topics from there, and then we spoke as it is. For the second revision, we were able to do it within the 1 week period, which was given right before the exam. As I said, like my internal was the first, yes, and then the surgery. So I had after internal Viva 1 week of gap, or 3-4 days for the preparation of MCQ. Mm-hmm. So for that time I prepared the second revision. So that was the surgery preparation.
So like with this preparation, you were able to pass it with great success, I would say. So your strategy would be helpful for the people, those who will be giving the exams next year onwards.
For sure. For them, I'll say it's never too late and never too early to start preparing for any exam. So the people who are already in 4th year, I'll suggest them start preparing now itself. And the people who are in 5th year, start preparing now. It's now time. And for the people who have just started 6th year, do it. Just do it.
Are you promoting Nike? Their tagline, just do it.
Yeah, just do it. Never give up, because think of your parents who have sent you here after giving you so much appreciation, help, and money. You have to fulfill their and your dreams. So you have to do it.
That's true. That's totally correct. And then what about the next subject? Let's take Obscine, the preparation strategy, okay, and the sources.
Yeah. For the sources, I have used only Datta and Shaw, because these are the best books we can find. Also, I use Marrow because in 4th year itself, I have completed my obs and gynae from Marrow. So I know this subject very thoroughly, and I don't have to repeat it again and again. It's my favorite subject also.
That's good.
Right now I'm hating it, but yes. So it was like this. So I prepared the notes, and I have used in some notes from our seniors. Like there are some certain really good notes I have read. So I have prepared from them and made my own notes. Not my own notes, but from my friend, because I'm very bad at making notes. So I used his notes as a reference, and I have read the books. But as it was my last subject, so I know I'm gonna have enough time to prepare it. So I didn't revise it much, and I took it because for the obs and gynae particularly, I had 1 week of time for preparing for Viva and 1 week of time for preparing for MCQ as well.
Okay.
Because of it has stretched a lot. So I know I will be able to revise twice at that time. Though I have only revised once, which was my mistake, and I got confused in many of the topics. So I suggest everyone to be prepared at least twice.
And like the thing is, like it was your last exam. I would say that was the main reason because you lose that
Yeah, we
motivation
were
and the zeal.
exhausted. Yes. And people were like the juniors who have already done with their semester that started leaving, which was also a demoralizing thing. Like the people are leaving for home and we are stuck here giving exams for whole straight 1 month. So yes, it was terrible and exhausting. But it
That's
is all worth it.
that's really this thing disturbing when you're seeing your juniors are leaving and at that very point of time you know that you have to stay here for at least 1 to 2 months more.
Oh yes.
But like as you said, it was worth it. So that's the thing. At
Yes.
the end, if you are like able to conquer it, that feeling, like I mean, there is nothing in comparison with that feeling.
So true. Like making your parents proud, making yourself proud, your whole friends and family are everyone is like, wow, congratulations, you did it. And then you see your first year self and now your sixth year self. It's amazing. It's the whole journey is so amazing.
That's absolutely true. Like, and since you have also prepared it from Marrow, so
Yeah,
FMG के लिए भी now you have an upper hand in it.
exactly.
Then what about the last subject, the third subject?
So internal is the biggest and vast subject which you can prepare. So for that, we had for cardiology specifically, we do not have good books. We have Davidson or Chamberlain, but it doesn't help you much.
Absolutely.
So we use Medscape for cardiology specifically, and for the other subjects we had used Bellore, and the other one was Matthews. So these books helps us as a baseline but doesn't give you the much accurate information. So for that you have to refer to Harrison. But if you are using Harrison, I'll suggest start it at the beginning of the semester, first semester, so that you will be know what's going on. Because in for MCQ you will be needing it. But after the first 6 months has been done, don't touch any of the books.
Yes.
Use your own notes to revise.
Absolutely, absolutely. That's the main thing. Because if you will open
Yes.
the books during the second sem, you won't be able to finish anything.
Yes. Use Medscape, use Osmosis, use Ninja Nerd, any of those, but don't use books.
Absolutely. Because those sources are really helpful in order to retain the information.
Yeah.
Because exams
It
are all
will,
about retaining rather than your logical thinking.
right. For internal, it's more like logical thinking. Whatever you know for the practical, you will apply it and it will be done.
Yes, that's true. So, how was your overall experience of the practicals?
Practical skills were like, I'm really good at clinicals, I'll say, because I have worked in hospitals before, so I know how it works.
Yeah.
So it was really helpful throughout the journey. So whenever the practical classes was there, so I was ready to be there and I was mentally and physically present. I had made all of the videos beforehandedly. I had watched those videos twice or thrice throughout 3 or last 3 years, so I know what's going on. And when it comes to the practical exam, so one day before, I watched all of those videos at least twice. I had made my own short notes for that, and also for the internal, we have used Chamberlain for the theoretical part. For ECG, I would say you have to make clear your basis. Find a good teacher or a good book. For example, ECG Made Easy. It is really helpful, but don't use in the last semester. Use it in the first semester, so you will be clear and thorough with the topics.
Absolutely. I would say ECG is something that is very easy, but yet you need to prepare for it very well.
Very well, yes. And I'll say make short notes for that as well, like which lead is for which part. Like
Absolutely.
this lead will show the changes in the anterior lateral part or the lateral part or in the inferior part, like that.
Absolutely, absolutely. That is very important. Because like I remember during my final year, main thing that everyone was worried about was ECG.
Yes. It was very hectic because when you will hear about ECG is not being cleared by the doctors who are already practicing from last 10 years, and still they don't know. But you are a student, you have time to learn it, so learn it. It's just
Absolutely.
as simple as that. Just do it and be done with it. For the
Because you cannot escape.
and for the yeah, you cannot skip it. There's no point skipping it. Anyhow, you have to get it done by the day. For
Absolutely.
the surgery practical, I'll say I had watched those videos which will show you how to do palpation, because they tell you that you have to do palpations. They don't show you how it's been done. So you have to show it in the exam. They will ask you how to perform it. So just saw those videos, and for the knot tying, I used my shoelaces to practice how to do it. And for the suturing part, they have told us to be done with interrupted sutures, P type sutures, and Z type sutures. Only these three sutures were there, and they are very easy if you will practice it. So we had a foam, we wrapped it with a cloth, and we started practicing it beforehandedly. Like I love doing practical work, so I have been doing it since last 3 years. But for the last day, you just need to be done with two, and I have done it for 2 days straight, 5 minutes each, and that's it. And show your friends how to do it so that it will be in your practice and they will learn how to do it. So they will also learn it and you will be revised.
That's the best way I feel. Like if someone wants to revise and there is other person
Yeah.
who is not having any information about a topic, make that person sit. It will be beneficial for both of you.
Yeah. It will be easy to revise and it will be easy to make other person understand.
Absolutely. And what about the obs-gyn practical?
Obsgyne practical, I'll say, was much more easier, although people find it difficult. I don't know why. But the videos are like very informational. So whenever the teacher has been teaching you how it's been done, make a video of it. Try to remember those words which they are using because they want to hear that. But
Absolutely.
I'll say for my practicals, when I entered the exam hall, they didn't want you to listen anything. They just want you to perform and listen to the answer. For example, I had this question which was like colposcopy. So they wanted to know that I know what is going on. So they had this vagina put inside the cervix. Sorry, they wanted to
Cervix
know the
inside.
cervix which was put inside the vagina. So I was like, yes, this is this. So I was explaining how I done it, but they were like, no, just tell me the answer. So I told the answer and it's been done.
Okay. So they were like, they wanted to be just cut short it. They wanted to cut short it and do
Cut
it
short.
like,
Yes.
we don't care about the steps or anything.
Yeah. My second question was about heart palpitation of the fetus. So they were like, just count the beats and tell me. And they will tell you the position. I was like, oh, it's very easy. I got the transfer slide. They told me it's for first position, so I know it's supposed to be on the left side. So I put the that thing, what it
Fetoscope.
is called. I
Fetoscope.
can't remember now. Yeah, the fetoscope. I put it there. I heard, and I was like, okay, these are this many weeks, so I'll multiply it by 2 because 30 seconds you have to count. And then I was like, this is this much. And they were like, right, you're right. Just go. You're done with your practical. I was like, okay, cool.
I remember that because even I got that fetal heart rate wala question for during my practicals.
Yeah. It was very easy. I found like all of the practical skills questions I got was very easy. For internal, I got the ECG, which was LBBB, and the other one was pulmonary erythema. Like, what I'll say in this? It is pulmonary erythema. It happens because of liver diseases. And okay, it's done. And then the in the surgery one, I got the suture lines, like which suture is called which.
Okay.
So it was very easy again. And then the second question was Z type suture. I was like, I'm expert at it. I cannot do it wrong.
That's great because like you have practiced it at your room and you're practicing the clinical since your fourth year, as you said. So that gives you an upper
Yes.
hand in it.
Yeah, for sure. And even I taught it to many of my friends, so I know I cannot do it wrong because I have taught them.
Yes, because being a teacher, you know that like when you are a teacher, you get the confidence of those things when you're teaching something.
Yes.
and you cannot make a mistake
Exactly.
over there
And
then.
mentally, yes. Like you have practiced a billions of time, even in your sleep, you are practicing everything in your mind. So
Yeah,
it's sort of a revision going on every single day, even
absolutely.
if you are not performing with hands. So yes,
Absolutely, because that's important. Like when you're revising in the mind, that recall is also important.
yes.
And what was your like revision strategy during the last, like between the time duration of 3 4 days or 1 week that you had? Did you use active recall or passive recall, or how?
So I had this thing. My notes were ready. So I
Yeah.
had read it at least once or twice for each and every subject. So I know what's written where.
Yeah.
So I have this memory thing which is like photogenic. Whenever I see something I have read twice, it is there in my mind. So I had, whenever I was revising it, I had made much shorter notes, which is only made with those points which I know that I'm going to forget. So for the MCQ, I had read all of those things, and I know that from previous year's questions, what are all there. I have revised those also, and for that I have prepared it. And just the day before, we thought we'll make a quick revision, which was not possible at all. But we know which was the strategy to be done was like just revise, go through once, and before sleeping or before walking around, whenever you are roaming and you do not have a book in your hand, just try to remember whatever you have read, what all things are in that topic. For example, surgery, we need to know what classifications are there. So those classifications are very important. And for surgery, they always say the paper are going to be very deep, but it's very superficial. Whatever was written in the bold letters, they asked only those questions. And we were so stupid. We were going deep, 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 deep. Our teacher was also like, Dr. Minasian told us, you guys are going very deep for revising and learning things. You need to be thorough with every topic, but for exam, you need to be superficial. But we do not know when they will change the questions to deep. Prepare for each and everything very clearly.
Because they are not going to give you another chance if you say that, so you told to not prepare in the depth. They'll be like, but you had the book, it was there in the book.
Yes, they have very easy answer for this. It's written in a book. Why didn't you read?
So basically, if someone who is not able to study in depth, if the person has an idea, like the proper idea about all the topics, that person can also pass this exam.
Yes. For example, for the internal, I wasn't able to be done with the revision or the topics. Few of the topics were left behind. So
Hmm.
I was lacking in the subjects. So that's why I was saying just do it. So for that, what I did is I watched all of those videos, which was like 10 to 15 minutes, not more. So
Okay.
I was able to know what is happening in this particular topic. So I know what is the definition, what are the things happening in this disease, what are the clinical features, and etc. etc. So
Yes.
I know if the question will come, I'll think of it and I'll apply my logistics for that, and then I'll be able to solve the question, which actually helped me with it. So when the topics were left, don't rush. Just have the basic knowledge of that topic and be done with it.
That's absolutely true. Because the basic knowledge is very important to crack any exam. Because
Any exam, yes.
like let's take an example of any exam, they are mainly revolving around the basics of any topic.
Yes.
Apart.
Like you can see and imagine like if the person has lung disease,
Hmm.
for example bronchitis, there's going to be cough, there's going to be bronchic like obstruction and everything like that. What will happen? The person will have dyspnea, and what etc. can happen, he or she can get cyanosis, or he may not get cyanosis. So you know what's going to happen like that.
Absolutely, because logic plays a key role,
Yes.
and the classifications for surgery just cannot even skip a single classification.
No. Even if we went to Dr. Manasian before the exam and we were like, sir, there are so many classifications which are not being used and which are not even mentioned in DAS because they refer DAS as the main book and Love and Bailey. So we're like, this classification has not been stated like this and it is stated like this. So he was like, when you will go to the exam hall and the examiner will ask you what's going to happen. So you're gonna start with the classification itself because that's what they want to hear. So say the classification from your own surgery book, university book. Then you can say that we have also been referred this book and it's been mentioned like this and that. But do not argue. It's like that. So you're like, okay, cool.
Because if you'll argue and they lose their thing, then you are gone.
Yeah, you're gone. No one can save you.
So how many members were there in panel for the Viva?
Okay, for different we have I'll say for step one. For the internal, I had 3 to 4 teachers over there. Two or three are from the cardiology department, and there was one rector kind of a person who was the examination head. He was looking after that some unfairness will not happen with the students. Then there was dean, and there's one more internal teacher who I think teaches rheumatology. I
Okay.
have never seen her, but I know all of the other 3 teachers because I have been taught with them.
Okay.
For the surgery, I think there was three teachers again. One of the examination head, then there was Dr. Vardanyan, then there was Dr. Haik from Meghalaya, and then there was Dean again. And for the obs gyne, there was Dr. Babloyan, but and the examination head and again Dean. But for few students, there was another teacher from Republic Hospital. I don't know who he is because he wasn't present in my exam. So he
Okay.
was coming and going for a few students.
Okay. So overall experience, how would you like to rate this experience?
On the basis of different criteria, I but like for the terrifyingness, it was before the exam it was like 10. After the exam, it was like 0. For the overall experience, I would say it was 7 or 8 because yes, we are terrified, we are nervous, but after the exam was done, like it was so easy. Why I was so nervous? It was like that. And some of the seriously stupid mistakes we make because we are nervous. So
That's
don't be
correct.
nervous because I know what happened. But anyway, you're gonna pass the exam at the end of the day.
Yeah.
And if
Provided.
you don't, just don't lose your heart. You will get more information by studying it again. Just don't
Absolutely.
lose your heart.
Absolutely. Absolutely. That's totally correct. So only thing is, I would say कि, for MCQs, just person has to give his 101%. 100% से भी नहीं
Yes.
होगा.
नहीं होगा. बिल्कुल नहीं होगा. For Viva and practical skills, I will say just give for practical skills. I will say just give your 1 day or 3 to 4 hours. That is enough.
Yes.
If you know the topics beforehand.
Yeah.
If you do not know, then you have to give one whole day. For the Viva, I'll say you have studied everything for MCQ. You know the topics very well. Just watch the videos and give your 50-70% and you will be done. If you want to get high score, of course, you will give your 100%.
Absolutely. No, so my congratulations once again to you.
Thank you, sir.
And the information that you have provided will help. I feel for upcoming next 2 to 3 years at least, because I don't think so that because they are going to change the pattern any soon.
I hope so.
Let's hope for it. So thank you so much, Srishti. If you have something else to say, you can.
No, I'll say just give your best, all the best. Just don't lose your heart. Keep going, and it will all be worth it.
Absolutely. Even my advice is that thing for the students, that if you are not prepared in 4th year, 5th year, it's always better to prepare early. But please start preparing as soon as you enter 6th year. उससे ज़्यादा delay मत करो.
Yeah. And if for some reason you are not able to complete all of your topics, it's never too late. Be done with it.
Yeah, that's correct.
खत्म करो.
खत्म करो. At least do it once. Basics information रख लो. Basic information is important. Absolutely. Hello, thank you so much. Let's wind it up.
Thank you. Yes.
Yeah. So I would like to wish you good luck for the future exams and future endeavors, and hope to see you in India very soon.
Sure, sir.
Okay, take care, Srishti.
You too, sir.